Before COVID-19, what are called zoonotic diseases were hardly the stuff of ordinary conversation. That changed, of course, as we all brushed up on how diseases in bats could or could not jump to humans. Similar questions have cropped up lately about the avian flu and whether we learned the lessons of the pandemic well enough to react quickly for the next time. To get some insight on that, we're joined in Guelph, Ontario by Shayan Sharif, professor and acting dean at the University of Guelph's Ontario Veterinary College. And here in the studio, Jason Nickerson, Humanitarian Advisor to Canada for Doctors Without Borders. Jason, good to see you again. Thanks for you flew in from Ottawa today, so we're grateful for that. Professor Sharif, nice to have you on the line from Guelph. Why don't you start, Professor Sharif, tell us, what do we know so far about the H5N1 bird flu outbreak?
So this particular strain of avian influenza virus came to Canada approximately 14 months ago in December of 2021. We first detected the virus in eastern Canada, and since December of 2021, this virus has spread to all of our provinces, and it has indeed crisscrossed the country twice over. So it can be found in many of our flocks, many of the in all of our provinces, and unfortunately, it has also begun adapting itself to mammalian species. Last year, it was primarily found in birds. Late last year, we began looking at some mammalian species that have contracted the virus, and it seems to be actually getting more and more adapted to mammals.
The most updated numbers I have here are as of February 23rd. They've got what is it here? 240 cases of human infection of H5N1 reported by the World Health Organization. Now, 240 cases is certainly not COVID-19 style numbers, but how concerned do you think we should be about a wider outbreak?
Well, any number of human cases that we detect is really disconcerting, because it does mean that the virus is gaining more momentum, is gaining more adaptability to humans and to mammalian species. So any numbers, in my opinion, is alarming. It's not actually too bad when you think about the previous outbreaks of H5N1 that we had in late 1990s and also in early 2000. Unfortunately, during those outbreaks, approximately 480 people died of H5N1. But like I said, any human morbidity or mortality is yet another alarm that would go off for public health policymakers and authorities, and also for us in the veterinary field.
Well, Jason, I guess we can't make this point strongly enough that this is very fatal, can be very fatal in humans. How well equipped do you think we are right now with vaccines or other ways to prevent transmission of this avian flu?
So I think there's a few important things to keep in mind. So first of all, this is a different scenario than we were in at the start of, say, COVID, where this was a novel virus that was emerging. That's not the case here. In fact, there are obviously influenza vaccines that exist. And in fact, there's antiviral therapeutics that also exist. So, we're starting with more knowledge of what this virus is and more about its epidemiology in animals and also in humans than we were with COVID-19. So that being said, it takes time to make sufficient numbers of influenza vaccines to be able to, vaccinate people if it's felt that, that becomes necessary. So, it does still take time to produce millions of doses of anything in the world. But as I say, we're starting with a bit of a technological advantage if we ever get to that point.
Well, more knowledge, but more fatigue as it relates to these issues as well. Does that concern you?
Yeah, I mean, no question. And I think also with the COVID pandemic, the world became much more acutely aware of the need for there to be equitable access to these medical tools. And we know that even with seasonal influenza vaccines, these are primarily being used in high-income countries, despite the fact that there are, of course, cases of influenza in low and middle-income countries. So, we need to be acutely aware of the fact that it's not just about producing vaccines and producing therapeutics, it's also about making sure that everybody who needs access to them is going to have access to them.
Professor Sharif, next angle on this story, I wonder how concerned you are about the risk of mutation each time a highly infectious kind of influenza visits us.
Well, unfortunately, COVID-19 has given us, or perhaps fortunately, it's given us a lot of lessons in terms of what we know about biology of viruses. And I would say with a lot of humility here, that we don't really know how these viruses is going to behave in the future. What we do know is that viruses, generally speaking, are quite unpredictable. So things could go in various different directions, and there is very limited amount of predictability in behavior of viruses. So as Jason has also pointed out, and I think that's a really critical point to hammer home here. We need to be prepared. This is not the time to panic, but this is the time to be prepared. Again, as Jason has correctly pointed out, it's not just a matter of producing a vaccine. It's a matter of producing a vaccine that is highly efficacious, that is highly safe, and can be deployed to a wide variety of populations in many geographical locations. So even though the risk for mutation of the virus may be low at this moment, for gaining capacity for transmission to humans or to poultry or other animal species. We have to be ready for that possibility, even though the likelihood of that possibility is probably very low at the moment.
Jason, do we know if this is the same strain or variant of H5N1 that has visited us in the past? Excuse me?
That's I'm not the expert on this, so I don't want to go out on a limb. But what I certainly can say is that the conversations that my colleague is mentioning here, I mean, these are conversations that are starting among the public health community of exactly what steps might we need to be thinking about putting in place if we do need to tailor a vaccine and start scaling up production?
Well, that's exactly what I'm wondering. So, Shayan, do you know whether or not, if we were to scale up production of vaccine, whether we've guessed the cocktail correctly that would be able to take on this particular H5N1?
Well, I think there's a very good chance that we can take it on, and this virus has actually been around for some period of time. It has not hit us in Canada to any extent in the past prior to December of 2021, but it's not as if we didn't know that the virus existed. So the virus has been around for some period of time, and we have a pretty good idea of the sort of vaccine candidates that we can use, both for poultry and also for humans. Now, the question is, are we really ready for producing vaccines to the level that is required? Have we looked at safety and efficacy of those vaccines? And the answer is not really. I think the reality is that we have a fantastic platform for production of seasonal flu vaccines. And many companies currently are doing that in Canada and also across the globe. So in terms of capacity is there, but they haven't really focused on pandemic influenza vaccines in Canada specifically. In the US, companies have done that historically, but not necessarily for this particular pandemic potential virus. Like I said, this is not a pandemic virus, but it's a pandemic potential virus that we need to look at. But first and foremost, we need to make sure that any vaccine platform that we use is going to be creating a safe and highly efficacious vaccine.
Jason, let me follow up by asking you about a pandemic virus. I note the World Health Organization has decided to extend the COVID-19 pandemic into its fourth year. What do you think the significance of that announcement was?
Well, I mean, I think in the simplest terms, it tells us that the pandemic's simply not over. And I think that, reading into that, we need to consider the fact that, of course, the virus is continuing to circulate. I suspect most of us know people who in the past weeks and months have contracted COVID for the first, second, or potentially third time. So the virus continues to circulate. I mean, I can say that for us as a medical humanitarian organization that's working in 70 plus countries, we've seen significant disruption to routine health services and programs that are there to respond to other infectious diseases as well. And so for us, a message that the pandemic isn't over, also signals to us that, yes, of course, we need to continue to respond to COVID-19 and pay attention to that. But, it also signals that we need to be focusing our efforts in responding to the other health services that have been disrupted and, trying to close some of the gaps that have been created.
No, I take your point on that, but okay, let me follow up on this angle. The avian flu is not a global pandemic yet in the way that COVID-19 was or is. That's great. How has the COVID-19 pandemic affected the way that we approach other potential pandemics, such as this one, that you'd like us obviously to be concerned about?
Yeah, I mean, I think the world is obviously a bit more alive to the fact that there are pathogens with pandemic potential that are lurking. Some of those are viruses that we know of, and some of those are viruses that we probably don't. And I think that there's a few things that have come to light. One is that we do need a plan in place for preparing vaccines, therapeutics, diagnostic tests quickly when we need them. So, even in the last couple of months, there have been outbreaks of other viruses that are deemed, pathogens with pandemic potential. There is an outbreak of Ebola Sudan, which is a slightly different species of Ebola than what usually causes outbreaks. That happened in Uganda in September. There's no vaccine that is approved. There's a few vaccine candidates. More recently, there's been outbreaks of Marburg virus disease in Equatorial Guinea. Again, same scenario. No vaccines, no therapeutics that are approved. So, I think the world is more alive to the fact that we need to be investing in these. What's missing, though, is a model for developing these tools, because we're essentially talking about preparing vaccines and therapeutics for these diseases and others for outbreaks that haven't really happened yet, or they happen, sporadically with small numbers of cases and so on. So it's really challenging to do something like incentivize the development of a vaccine by, a pharmaceutical company that typically is looking to recoup their investments and make profits when there's not a profitable market, so to speak, on the other side. So, when we're talking about preparing for future pandemics, I think medical organizations and governments and so on are alive to the fact that we're going to have to invest in a slightly different way in developing and preparing the tools that we're going to need, so that we have candidates that are ready to go, that we can move into clinical trials and so on relatively quickly, so that we don't have a big gap if and when we have outbreaks of diseases that are of concern.
Professor Sharif, bit of an odd question here maybe. Climate change, how has that influenced or affected the development of some of these outbreaks that we're now experiencing?
Well, that's a fantastic question, Steve. We don't really have a huge amount of evidence, experimental evidence, but at least based on epidemiological evidence, it appears that climate change has had some impact on emergence of new viruses. And when I say new viruses, I don't really mean that de novo viruses all of a sudden being, created. I'm really talking about new strains of viruses, or viruses that existed, but now they're gaining more virulence, and as a result of that, they're becoming more pathogenic. And what I mean by pathogenic, it means that they cause disease, more severe disease, or cause disease in new species. So climate change, as an example, there are many different aspects and angles to this, but as an example, climate change can lead to the so-called spillover events, meaning that a virus or a pathogen can jump from one species to a new species. The old species is a species that was quite adapted to this virus. So the species might have harbored the virus, might have served as a reservoir for the virus, but didn't really succumb to clinical signs of disease. So as a result of that, we wouldn't really get alerted because of emergence of disease in that particular species. But now, because of climate change as one of the contributing factors, now that species has the opportunity to interact with a totally, entirely new species. So as a result of that, there would be a lot of exposure to new viruses. And as a result of that, there is a possibility that these viruses could jump from one species to another species. And our concern is that at some point of time, they could also jump to humans. So as a result of that, climate change may indirectly or directly lead to emergence of new viruses, and viruses that are perhaps more virulent, or they can cause more disease for the new species that they interact with, or for humans that interact with those species.
Jason, we already have a pretty good list of reasons why climate change should be avoided, but I guess we can add this to the list, right?
Yeah, absolutely. I mean, look, this is one of the things that we're paying attention to very closely in our own projects. And we're already seeing some of the implications and the impacts of climate change. So, a very common disease that we treat in our programs and in our medical projects is malaria. So malaria is a parasitic disease. It's a leading cause of death, particularly in children in low-income countries. What we're seeing already is that as a result of climate change and a result of environmental degradation, we're seeing changing patterns in malaria seasons. So, a malaria season can be affected by rains, by droughts, by, anything that sort of changes the breeding ground and the overall population of mosquitoes. And so we're seeing malaria seasons that are more intense, that are slightly longer, that are coming at different times than what we would have anticipated. And so we're acutely aware of the fact that climate change is going to really challenge even some existing disease control programs that exist in the world, and then of course have the real potential, as my colleague was saying, to introduce new interactions between different animal species and sort of increase the potential for spillover events.
Well, to that end, let's bring it home here then in our last couple of minutes, and that is on Tuesday, Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, released his annual report, and here's something he had to say in the report. He said, history tells us that once an event like SARS, H1N1, or COVID-19 passes, complacency often sets in. Funding is redirected and readiness wanes. Yet the risk of serious disease outbreaks and another pandemic is real and growing. Population growth, land use practices, climate change, the growing international wildlife trade, and global travel are making it more likely. Professor Sharif, how do we ensure that policymakers don't get complacent and take their eye off the ball here?
That's a fantastic question, and I wish I had a fantastic answer for that, Steve. First and foremost, I think one of the issues that COVID-19 has really brought home is the fact that we cannot really act as silos. We need to have cross-cutting departments and organizations. For example, within the federal government, we cannot really look at any of these issues arising from pandemics or pandemic potential pathogens as, let's say, just a public health issue. It goes in a wide variety of different angles and aspects. And I think, as just one recommendation from someone, who doesn't really necessarily have a huge amount of understanding of how governments work, but I can tell you one thing that is for sure, and that is the fact that we need to have a much more holistic approach towards dealing with pathogens and dealing with pandemic potential viruses more specifically. And as a result of that, I think collaboration among various different organizations within the government would be of utmost importance. But that's just one aspect. I'm sure that there are many other aspects that my colleague Jason would be able to tackle much more eloquently, especially from the human health side of things.
I don't know about more eloquently, but I'm going to give him a shot at the question anyway. There is such a temptation once you've sort of turned the corner on something to just sort of let your guard down, and we got to be careful not to do that. How do we sort of remind everybody, the policymakers, not to do that?
Yeah, I think one of the other things is I agree with you, and I think one of the other things that we see in emergencies as well is that we respond to the emergency that's immediately in front of us, sure, right? And sometimes that comes to the neglect of other things that are still happening. And so I think one thing that all of us in the public health community right now are really concerned about is the fact that there is a large gap in vaccine coverage for diseases like measles, for example. So we are seeing this in many of the places where we work. We know that around the world there's about 23 million children who've missed immunizations during the pandemic. There's about 17 million children who didn't receive any immunizations at all during the pandemic. So one of the big consequences of that gap that we're seeing is large measles outbreaks. So last year in Democratic Republic of Congo, for example, there was an outbreak. There were about 148,000 cases of measles, about 1,800 deaths that occurred. Now that's a country with, it's affected by conflict. It has a weak health system and so on. Excellent public health professionals on the ground, but it's a challenging environment to vaccinate kids in. But we're also seeing measles outbreaks in other places where we work, such as Afghanistan and elsewhere. Now, that's not only a problem in low and middle income countries. I cited the global figure of 17 million children who've missed vaccines. Last week, Ottawa Public Health issued a warning that vaccination coverage was dropping in Ottawa as well. So, this is a global phenomenon. I think it's in many ways a consequence of, us sort of focusing on COVID-19 and as you say, sort of taking our eye off the ball of some of the infectious diseases. I think that we are really concerned about the fact that there is this gap, not only for measles vaccination, but also for other vaccine preventable diseases like polio, yellow fever, meningitis, and so on. We know that there are gaps in immunization coverage for particularly children who are living in low-income countries, and we're really quite concerned that as a result of this gap, we're potentially going to see outbreaks of those diseases as well. So it's not just pathogens with pandemic potential. We really need the world and public health officials and governments and policymakers to be acutely aware of the fact that there are disease outbreaks that occur on a daily basis that don't attract the same level of response and engagement and investment in research and development, but that have real significant public health implications for people who are affected by them.
Let's hope they're watching. That's Jason Nickerson, Doctors Without Borders, Shayan Sharif, Professor, Acting Dean at the Ontario Veterinary College at the University of Guelph. I want to thank both of you for coming on to TVO tonight and sharing your views. Many thanks.
Thanks so much.
Thank you very much.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.